Hip arthritis, like other arthritis throughout your body, is simply when the nice smooth cartilage that we normally have in our joints wears out. Normally in a joint, the smooth cartilage allows for free motion and painless walking or using that joint. In hip arthritis, that cartilage wears down, so instead of a nice smooth surface, you have roughened surfaces and bone that starts to rub the bone. That causes pain and that causes inflammation as well. Prior to any surgery, you do have a few options. You can start with some medications such as Tylenol or anti-inflammatories like ibuprofen. There are also the options of cortisone or joint injections that can help to decrease swelling as well as pain. Hip replacement can occur either through an incision directly in the front on your thigh or along the side of your thigh as well. Either way, the result is the same. In hip replacement, you provide a new cup that is placed inside of your pelvis. Okay, that's what that looks like there. There's a plastic or polyethylene liner that locks inside of that. Along the thigh bone, this fits inside the thigh bone, okay? And there's a ceramic head that fits on the end. So a hip replacement is simply this. So when you walk, that is what you're walking on, and that is your new hip replacement. There have been many advances in what we call the perioperative pain control around the surgery time period. Prior to any surgery, you will talk with the anesthesiologist. Typically we're using a spinal anesthesia, which is kind of like an epidural, when they numb your legs from the waist down. You're still put asleep from the surgery, but you don't have to be intubated or tubed. This allows you to wake up quicker. It also decreases your pain after the surgery. There are certain medications that the anesthesiologist will give you during the surgery to decrease pain as well. While you're still asleep, but after the new replacement parts are in, I use a local anesthetic that I inject into the tissue around either the hip or the knee that really helps to take away the majority of your pain for the first 36 hours. This allows you to get up on the same day of surgery, walk with a therapist, and get home and get through that first night into the next day. Going home after the surgery, we send you home with an ice pack machine. We send you home with anti-inflammatories if you're allowed to take those, and also a pain pill or a narcotic pain pill if you need it during your recovery time period. I encourage all of my patients to go home the same day of surgery. Because of the advancements that we've made in the anesthesia and the pain control around the surgery time period, patients are actually more comfortable going home the same day because the nerve blocks and the medications are really working well. We get you up walking on the same day of surgery with a physical therapist so they can go over different tips and tricks to help you get around the house. And patients have very much enjoyed going home the same day to get home to your own bed, your own food, and have your family support as well. Hip or knee replacements typically nowadays should last you hopefully 20 to 30 years. In the past, sometimes they would last anywhere between 5 to 10, but now with the new technology, specifically with the polyethylene or the plastic piece that goes in those hip and knee replacements, these should last you now hopefully 20 to 30 years and maybe even longer.